Good afternoon, Chairman sir, organizers and friends. From the perspective of management of children with diabetes, which Dr. Chingan took, especially in the underprivileged scenario, to the science which we have just seen with Dr. Shrikanta, I am trying to give a focus on what it feels like from a youth perspective. A child with diabetes who is growing up and is going to be an adult, and that child is confused, is feeling the pain, is going through this process, because probably if we have an insight into that, it will help us to treat the child better. Youth is the time of life when one is young, the time between the childhood and maturity. Some of you in the audience can probably remember your own youth, and most of us will have children who are in this phase. So we know anyway, the definition itself tells us it's neither here nor there, and it's already difficult without having type 1 diabetes. But how does type 1 diabetes make it any different for them? The ultimate goal of the treatment that we have been talking about through various aspects of science and care is to maintain the best possible glucose level with the development of a child as a confident and independent individual. So even if we have the best HbA1cs in the world, but if you had a depressed individual who is unwilling to go out and do or pursue his dreams, I really wonder what that HbA1c would do. So it's a balance between the two. Here are two boys from Udan, he's Mohsin and Salman. Mohsin wanted to become, they were both 8 years old when they were with me. This is their recent photograph last year. He is a sports teacher now and he does gym and is going into modeling. Both of them wanted to go into the police, which was not practically possible. When they were training, they would land into hypos, but still they tried. But then they would have to lie to get in, and after a lot of counseling, they were convinced that there was no point in basing the foundation of their life on a lie, and finally they're pursuing different careers. So that is what I wanted to give a perspective of the kind of journey that youth goes through. The challenges of the young are well known to us, but I just want to see what the challenges are naturally in a youth, but also what happens, how it translates into a youth with diabetes. The natural challenge is self-esteem. Self-esteem is very precious to a young person. A teenager would look at himself or herself in a mirror, is conscious of pimples, of hair, of what they look like, what they wear, how they're accepted socially. The peer acceptance is very important to them. And the sexual identity that is now coming with puberty is of utmost importance. Getting attracted to the opposite sex being attracted to them is of prime importance, as we see in all our children. But what happens with diabetes in a similar scenario? If their self-esteem is low, they isolate themselves. The more they isolate themselves, the further their self-esteem falls. And they have this feeling of a lifelong disease. And that is what takes away the peer acceptance and sexual identity. They don't even try it. And because they feel that somebody will come to know that we are diseased. Today there's so much of media overexposure where everyone is fair and lovely and perfect that they feel they're imperfect. So many young people, when we talk to, they feel that who will like me, who will marry me, who will be my girlfriend or boyfriend, which is of so much importance. We may think it's trivial, but if you put yourself in those shoes, and it's probably more important to them at that moment than their blood sugar level. And the barrier they blame is diabetes, because the independence which is so inherent to that age is limited because they are bound to a diet and insulin regime. When the children are so spontaneous, they want to go for a movie, they want to go for a bike drive, they just want to go to the chai ki tapri in the corner and have tea spontaneously. And if every process which is natural to a young person involves at every moment thinking of what they are eating and how much they have to inject themselves, then the growing process itself is a burden, but now it becomes a burden that starts blaming diabetes. We have already talked about the budget. Materialism is significant at this age, especially today. With so much of exposure, you want the best shoe, the best t-shirt, maybe even in the underprivileged. We have children who cannot afford insulin, but still would maybe have 2 pairs of clothes, but would like to have the best, and I don't blame them. But funds are a priority. And again, that whole fear of what will my career and vocation be like? Will I be able to do it, and am I fit? So all the natural challenges of this age get so much more worsened, and the blame goes to diabetes, whether it's true or not, but that is how it is perceived by a young person. But how does a young person react? The young person reacts in rebellion. We will see a number of, I won't call them children, because children usually end up listening at least or under parental control, but they refuse to monitor. They go on food binges and they manipulate the test results. We have so many young people who come with amazing logbooks, because it's essential in our center to have their logbooks. They plan the erraticity of their log. They manage to make it look 60 once and at least an occasional hypo to make it look real. We often tell them, if you use this much of intelligence in controlling your blood sugar level, it would have gone such a long way. But that is the kind of manipulation they do. And the other reaction is isolation. We had a girl who was refused to take her on a school trip. She was in 9th, and publicly the teacher said and the students said, we can't take you because it's a 3-day trip, you can't take your insulin. That whole rejection process put her in isolation. She actually from there went into clinical depression, and it took 3 years or more to get her stable and out and now into a routine life, which we don't realize how a small trigger is important at this age, and denial. Sometimes when it just gets too much and everything is about diabetes, because with young people, when everyone comes home, they say, okay, how was your sugar? What did you eat? Are you okay today? Did you have a hypo? So it's not about them. Nobody wants to know how you are, as in not about diabetes. It's always about the sugar and the blood sugar, which is, they just start saying, okay, I'm not diabetes. I have diabetes, but I'm not diabetes, and they just ultimately go into denial, and there are people, the young people who skip insulin. And lastly, it is an aggression, which we see in our own children. They get angry, they shout back, they fight back, but this is all, in diabetes it can be worse because it would lead to alcohol, drug abuse, or even deviant sexual behavior. I have a girl who is now, after a lot of rejection from boys, and she lives in a group where every girl had a boyfriend, and she was the only one who did not. And finally, she's experimenting with her sexual identity, and she's frank enough to come and tell me about it. And she asked me, shall I do this? And it's a, as a mother, as a parent, it's very tough to comment on that, but that is to the extent these young people can go, provided we look into it. The physical challenge, of course, we all know. The blood sugar levels in the pubertal age group are often difficult to control in spite of the best possible care. We know that you can have extreme high and extreme low because all the growth hormones and all the changes that are happening. So this, with the best of care, leads to a lot of frustration and blame by the parents. The parents keep blaming, you must have eaten something, you must have done something wrong, this must have happened, you can't control the sugar. And hence the frustration and evasion by a youngster. So many of them write false diaries. They just don't tell their parents. When I ask them, why did you do this? I won't tell your father, just tell me why. They said, every time I tell them it's a high sugar, they shout. They shout, they stop my TV, they punish, they don't let us go. So it's better just to tell them everything's fine. Anyway, they can't come to know. So that's how the youth react. And so what can we do about it? It was already talked about by Dr. Chingan. Of course, we need a structured but individualized guideline. We can empower them by training them in nutrition, exercise, monitoring, dose adjustments, investigations, emergency care, and counseling. These are two young girls as an example of this structured and individualized care. That's Archana and Varsha. Varsha is now in engineering college. Archana is a teacher. Both of them live alone. Archana lives in a room in Nasik, and Varsha lives in a hostel. Both of them went through a phase where parents, as it was mentioned earlier, they said, we don't want you, why don't you die? But because they were empowered to take care of themselves, and they were in a group program, they had lots of friends who kept on calling each other, and also they had people they respected and loved. Today they are independent young girls. Of course, marriage is still, I hope not a distant dream, but it is still kind of a scary thought for them, and they're not sure what's going to happen. But they are girls on their own feet today. So what can be done? What can we do? Diabetes education and individual counseling is an absolute must. I think it was mentioned earlier again, but to treat type 1 diabetes with insulin is absolutely not enough. Flexible meal timings and basal bolus regime to empower them for diabetes and life both. So if they're going to college, if they have different classes, they're going to tuition, they have to go cycling on a bike. So not having the restriction because of diabetes empowers them and makes them hate their diabetes less and probably accept it better. Group education and camps really have a positive peer impact. As you can see, these are all Udaan girls. So if they're having kulfi, that was the treat they had all together, and with the educators and everyone, so they knew how to count their carbs and they also knew how to adjust their doses. These two girls who are dancing are sisters. There was a phase when the elder sister has Juili, her name is. She is type 1, her younger sister does not have diabetes, and there was a time this girl used to refuse to come with her sister. She said, just don't call her, I don't like her, I want to be special, I want to be away from her. But now the time has come, both partner and they're very good dancers, so they present their programs all the time. Sharing responsibility between a child, parent, a healthcare team. If dividing the responsibility we have seen really helps. So each knows what is their job. Sometimes I tell the parents that, okay, you take care of this part, and whenever something off track happens, let my counselors or myself take care of it. You don't scold them. Let the scolding come from me. Or you scold them, I'll be the nice person in this group. So a kind of sharing has to happen. If everyone is shouting, everyone is preaching, everyone is scolding, it becomes just too much for this age group, as we all know. Positive reinforcement rather than nagging works. It really works, as it will work with our own children, also with type 1 youth. Parent sharing and strengthening sessions have really helped. We run something called Palak Shala, which is not with children, which is only the parents, and that is a time they open up to everything. We call counselors, we have interactive session. You can see a father here sharing an incidence of, in fact, he was sharing a sad incident when his daughter ran away one of the evenings out of sheer frustration, and how they got her back. But after he shared, so many people got up and said, okay, something like that has happened in our family too. And then they worked out a solution, and they become parents. They can call each other and sort of support each other, which makes a big difference to these people. What we need to understand is the child needs, youth has a need of spontaneity, but we need to make them understand that good control and understanding of type 1 diabetes can give them that flexibility. We need to understand that a youth needs to have control. They need to ride the bike, to take their own action. But we need to make them understand that only discipline and diabetes, self-care can give them mastery over their own lives. But we also need to ultimately understand the limits of our control. Be realistic. One cannot watch over them every moment of their life. Finally, it's their own life. After all has been done, when there is still a sense of frustration, whether it's parents or a healthcare person, ultimately it's their life. After a certain time, they have to take care of them. So we do need a team, as has been talked about, a team of doctors, educators, nutritionists, counselors, psychologists, parents, volunteers is needed to give this kind of optimum care. Or sometimes, as must be the case all over the country, the treating physician has to be all of them rolled into one. Sometimes, it's just talking and listening is enough. Just sparing a little time, you can become someone roll all into one and make a difference. I know it's a tough call, it's very difficult, it's an uphill task. We all do not have time and resources to do it, but I still feel, looking at the number of children we have and the potential they have to achieve as future citizens of India, as productive future citizens of India, that we have promises to keep for these children, and we definitely have miles to go before we sleep. Thank you so much.